Hi everyone, welcome back to my channel, and in this video I will tell you about athlete's feet. Athlete's feet is very important topic for NEET PG and also for FMG examination. So watch this video continuously. You will have a great knowledge from this video. I will tell you the treatment and also what is athlete foot, what is causing this condition, everything in this video. So what is athlete's foot? Athlete's foot is basically Tinea pedis. It is also known as Tinea pedis. Why it is called Tinea pedis? Let me explain. Tinea means a kind of fungus and pedis means foot or leg. So it affects the foot, and that is why it is known as Tinea pedis. Basically, athlete's foot can be found in the athletes and also to the gym goers. So those who go to the gym, they have a sweaty feet and they get this disease, athlete's feet. Basically it is caused by a fungus and it is just like a ringworm infection. So it is a fungal infection called ringworm that affects the feet, and it is known as Tinea pedis when it affects the feet. When it affects the groin, it is Tinea cruris, and when it affects the body, it is Tinea corpora. All these things are different names. Okay, look at this picture. This is the picture of athlete's feet. You can see how it has caused a kind of scaly lesion. You can see the scaly lesion. These are very important to identify athlete's feet. Whenever you see a scaly lesion in the feet, sometimes it is also found with crackings. Sometimes the skin cracks and we get athlete's feet. So different kinds of presentation, but scaly lesion is very common. You can see how it appears. Basically it affects the toes of the feet. You can see this. So what causes Tinea pedis? You can see Tinea pedis, or also known as athlete's foot, or also known as foot ringworm, is a kind of infection. Basically it affects the sole of the feet and also interdigital cleft. Basically it is found between the digits, the cleft between the digits. So it is known as interdigital cleft of the toes, and also the nails are affected, and this is caused by a fungus, and the name of the fungus is dermatophyte. This is very important. The name of the fungus is dermatophyte. Do you know what is dermatophyte? Dermatophyte is a kind of fungus that affects particularly the skin of our body. The skin is affected, the nails is affected by a particular type of fungus known as dermatophyte. And you can see this is athlete's foot. Athlete's foot is a condition which affects those who have a sweaty feet. So what is the name of the dermatophyte? You have to remember the name of the dermatophyte. The name of the dermatophyte is Trichophyton rubrum. This is very important. Trichophyton rubrum. It is once an endemic in many parts of the world like Africa, Asia, Australia. So you have to remember this. Which has caused it? It is caused by a dermatophyte, and the name of the dermatophyte is a MCQ for NEET PG and FMG examination. You have to remember it is Trichophyton rubrum. Now this is the original picture. You can see how it has affected, how the scaling of the skin has occurs. Sometimes cracking of the feet also occurs, and also sometimes between the digits it affects the cleft. Now why this happens? This happens basically to the persons who always wear socks. So if you are a sock user, be careful. Do not use sweaty socks again and again without washing it, drying it, cleaning it. So you have to be very much careful about it. Whenever you are using the socks, you have to wash it, clean it, dry it, and use cotton socks. Very important. You have to use cotton socks, because whenever you are using different kinds of socks other than the cotton socks, maybe nylons and all these, which can cause abrasions to our skin and also harm our skin, then it can also cause this dermatophyte problem. which is athlete's feet. You have to remember these things. Now let me tell you one thing, that is how can we prevent this condition of athlete's feet. Number one, you have to remember that you can prevent it by using shoes which are well ventilated. So if you are using a shoe where it can, a lot of air can come inside and a lot of air can come out and go outside from your feet, so it is well ventilated, then it can protect you from this fungus. So well ventilated shoes, wear well ventilated shoes. You can use a flip-flops. You know, the flip-flops are actually the shoes which has a lot of ventilations, so you can use that. And change socks regularly. Number two is change sock regularly. I told you about the socks. You have to wash it, clean it, dry it, use cotton socks, and you have to change the socks regularly with regular interval. If you change them, wash them daily after you came from the office, from the gyms, it is very good. So the fungus cannot grow, because this fungus need hot and humid environment to grow. Very important. This fungus need hot and humid environment. Dermatophyte always needs hot and humid environment and grow on the skin. So you have to understand, you have to wash them so that if there is any fungus, it will go away with the water. Another is avoid walking barefoot in the public places. Sometimes we go to the public places barefoot. That is very dangerous, because in public places lot of people has already come and there is high probability that the fungus is already there. So avoid walking barefoot to the public places such as bathroom, locker rooms, pools and showers. Another thing we have to understand, we are very much guilty of, that is we share our shoes and also unwashed beddings. That is very important. You should not share your towels, you should not share your unwashed clothings, your beddings, your shoes, your socks unwashed. If it is not washed, you are sharing it with your friend, that person can also get the fungus from you. So you have to remember, because your shoe or that socks may contains that fungus, you have to wash it, clean it, dry it in the sun, keep it in the sun, and then you can give it to your friend. So it is very important. You should not share the clothes and also the beddings, unwashed items, basically the shoes, towels, all these items to your friends. Now look at this picture. This is the cream which is used in the athlete's foot, that is Canesten. Now what is Canesten? Canesten is the brand name. It contains a chemical, it contains a medicine known as clotrimazole. You have to remember clotrimazole. Clotrimazole is antifungal. So it is an antifungal medications which is generally used. It contains 1% W by W cream, weight by weight cream. You can remember clotrimazole. It is used in athlete's foot. You can apply it thrice daily or 4 times daily on the particular area. It is very famous. You can use it. So remember this. This is the end of this video. Thank you so much for watching this video, and if you like this video, make a thumbs up and please subscribe this channel and write down in the comment section below if you like this channel, because this inspired me to make many videos. And I will request you to visit the playlist of this channel, because we have separate playlist for medicine, for pathology. Like in medicine we have more than 100 videos, on pathology more than 100 200 videos. I forgot how many videos we have, but you just watch all these videos, run a playlist of medicine and watch all the videos one after another. You will have a great knowledge from this channel. I can promise you will have a lot of knowledge that will help you to crack your FMGE and also your NEET PG examination, because all these topics are very important for NEET PG and also for FMGE examination, because I have selected only those topics which are important for exam, not any irrelevant topics. Only those topics which has been asked in the examination, I have made video on those topics. So you will have a great knowledge from this channel. Please subscribe this channel and write down in the comment section below if you like this channel. Thank you. Have a nice day. Bye bye.